Hello there, my name is Dr. O. Welcome to the Ozone Medical Centre. You must be here for your annual physical examination, is that right? Perfect, well, you're in the right spot, that's for sure. Actually, I do remember seeing your name in the schedule, so let's step right into the medical bays and we can get started. Just to debrief, as part of today's examination, we will be testing various bodily functions and organs, such as your heart, lungs, eyesight, hearing, as well as your sensation or touch, things like that. Yeah. If at any point throughout the exam or today's session you feel uncomfortable, you experience pain, no matter how mild, please don't hesitate to let me know immediately and we can adjust our session accordingly. So, how does that sound? Excellent. Well, unfortunately we do have a bit of housekeeping to do. Really quick though, I promise. It'll take a tick. We've had to change our practice management software, and unfortunately some of our patient details didn't get transferred over properly. So, just a few questions to answer. Is that okay? Thank you. Yeah, just to update the system. Could we just start with your full name and date of birth, please? Yeah. So, yep. Okay. Excellent. And then just a couple questions. Have you been exposed to any potentially harmful substances in the last week, such as radioactivity or Fortnite? I'm just kidding about that last one. Yeah. Any radioactivity, things like that. Yeah. Okay. We have not. That is always a good sign. And lastly, have you experienced any chest pain, dizziness, double vision, dizziness, any sort of difficulty breathing or difficulty speaking, chest pain? I think I said that already. Any of those symptoms? Yep, okay. And we most definitely have not had those in the last 48 to 72 hours. Okay, perfect. And lastly, we haven't experienced any fainting episodes, no drop attacks where you suddenly fall to the ground. No, okay, perfect. Just making sure. You can never be too careful with these things. Well, if that's the case, if you'd like to join me at the medical plinth here, we can begin immediately. So let's start with your lungs. I know that they were okay from last year, but there might be some changes. So we're just going to be listening and auscultating, just a fancy word to listen to your breath sounds and see how your lungs are going. So I'll just get you to sit up nice and tall rather. Yeah, I'm just going to place this one on your chest, and if you could breathe in through your mouth and out through your mouth, that would be perfect. Yep. So it's a bit cold, I apologise. So there we go. Yep. Okay. Good. All right, now just the other side there. Yeah. How are we going? Good, good. Good. Right, now, I'll just turn around and put this on your back now. Yep, okay. One last one on this side. Yep. Okay. Well, my friend, you'll be glad to know that they're all okay. Nothing abnormal there. Normally we're listening for crackles or something abnormal, but they're all clear. So, excellent. Let's move on to our eyesight now. A couple tests. Starting with glaring at this pen, but not just anywhere on the pen. I want you to focus on the tip. Okay, so this is just going to test our ocular reflexes and our visual fields, as well as the stability and ability to fixate our eyes. Yeah, very important, especially when we're driving or doing everyday tasks. So let's focus on the tip of the pen here. Good, 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 good. And just following it, keeping your head still. Good. Just getting a closer inspection there. Yep, don't move our head. Good, following that nicely. Just in a diagonal or oblique movement now. Good, good, good. Okay, well, that part of the test is good. Let's check our visual field now, or our peripheral vision. Still focusing on the pen, I'm going to be moving it out towards the side. You let me know when you can't see it anymore. Okay. No, yep, can't see it anymore. Yep, it's good. And let's try the other side now. Let me know when you cannot see the pen anymore. Okay, about there. Excellent. Okay, now coming back in, let me know when the pen reappears in your field of vision. There, yep, good. And then the other side. Yep. Okay, good. Well, those are also fine and dandy. The other thing was a little light test for, like I said, reflexes in the eye. So I've got a bit of a torch here. It's quite on the bulky side, but it does the trick. So just glaring ahead, try to focus on a point, so my nose maybe, and looking forward for me. Just going to shine a light gently. Okay, here we go. Checking for the pupillary light reflex. There we want to make sure that there is a degree of constriction in response to the light, and that is all good. That is a resounding success. No dramas there with our eyesight, as well as our ocular muscles and reflexes. So all good. Just get this one off me. Now let's do a quick check on your skin. Do you find that you have sensitive skin or quite irritable skin by any chance? Not really? Okay, that's good. Well, we're just going to do a quick test to make sure. We've got a little bit of what's called kinesiology tape or K-tape. We're just going to be applying it on your various muscles just to see if our skin reacts to it. It has quite an adhesion to it, so kind of like a band-aid. Do you know if you're allergic to band-aids or get a response from those? Not at all? Okay, so we should be okay with this test, but just hold on while I do a bit of arts and crafts on this one to make sure it sticks okay. So that's it. Excellent. And just staying where you are, we're just going to get this little piece of tape on a point of your skin. Now let's get it on your top of your shoulder there. That's it. Okay. Placing that one on there. Give it a good stretch. Good. Okay. Right, we'll just leave that on for a couple of seconds and rip it off. Good. And no redness. You're not feeling any itchiness or like irritation in that area where I just covered? No, perfect. Okay, well, that is also good. Now, while we're at it, let us check your face. So, I'm just going to get these gloves on. Bear with me for a sec. I've been doing this for 20 years, but it's still hard to get gloves on for some reason, so bear with me. I apologise. Let's get this one on. Okay. Now, I want you to look forward for me. Just going to be touching various points on your face. Yep. Okay. Okay. Right, so I'm just going to be touching your left side, or my left, your right, in this perspective. I'll just touch your left side of your face, and we're going to compare that to sensations on your right, okay? Just to make sure there's nothing wrong with our nervous system, and then our central nervous system and our sensation, spinothalamic tract, dorsal columns, all of those are working fun and dandy, okay? A bit of anatomy for you. Okay, let's see how we go. So just your, my left, your right side of your face. Okay, good. Giving that a pinch, bit of a touch, yep. So that feels okay? Yep, okay, let's compare that to your other side now. Yep, okay. So does this side feel the same as that side? Yep. And they're both 100% sensation. You can feel them fully. Excellent. Okay, let's try another point on your face just to make sure. There are several innervations of your face where several nerves go and they innervate different parts of your face. So one spot might be less sensitive than the other and vice versa, depending if we have any pathology there. So it's important to do the whole face, not just one spot. Let's go up here. So does that feel the same as that? Okay, good. And does this feel the same as this? Good. Very well done. Okay, well, that's good. Now we're just going to test some of our muscles of mastication. Mastication is just a fancy word for chewing. So we use a lot of muscles to chew. I just want you to show me how you go making a chewing sort of movement. Yeah, so grinding those teeth, just making sure those muscles work. I'm just having a feel on your face or palpating your face. Okay, that's good. So almost like you're grinding your teeth together. Yeah, like you're crunching. Yeah, that's it. Good. Those muscles are working great. Excellent. And then opening our mouth, saying ah. Good. Okay, excellent. So still keep your mouth open there. Just having a look inside, checking that our uvula is looking okay. Yeah, the little dangly thing in the back of our throat, that's what that is, the uvula. That is... Yep, just keep your mouth open there. That is all okay. Okay, so just sit tight. I'll just get these gloves off. And now just a bit of a hearing test. I'm just going to be performing different sounds and I want you to let me know if you can hear them or not. So just the first one, a bit of a whisper. Just to hear it, let me know if you can hear low frequency, low decibel type sensation. Oh, sensation, low decibel type hearing. Okay. Can you hear me? Yep, that sounds okay. Right, now next step, just talking in my regular speaking voice. So right now, this is roughly my regular speaking voice. You can hear that okay? Perfect, okay. Let's try a couple different sensations and sounds. So can you hear this okay? Okay, how about this? And this? Excellent, okay. How about a few different sounds? Can you hear this? Yep. How about here? Okay. Excellent. That is very good. Now lastly, we'll just check your neck. I know that was giving you a bit of trouble last time. Yeah, so let's just go through a few movements. Got my little measuring tape here. Ooh, get that one on centimeters. Get inches out of here. And let's see how you go looking all the way over your shoulder now. So, yep. Yeah, that's the way, like you're looking over your shoulder. Like so. Go for it. Quick measurement there brings us to 13.2 centimeters. Okay, good. Let's try your other side now for me. Okay, good. And that is 0.1 of a difference, which is fine. That's no dramas at all. Then looking up, good, up to the ceiling. Yep, sorry, I know it's a bit blinding light up there. And then looking down. You going okay there? Not... Okay, yeah, sorry, it looked like you felt dizzy there. Okay, that's good. Now let's try bringing our left ear towards our left shoulder, like so. Yep, go for it. Just give that a quick measure from your ear to shoulder. Okay, good. And 10 centimeters, and then just your other side for me. Good, good, good. 9 centimeters. Okay, so and that feels a bit stiffer on that side. Okay, well, I might give you, if you're feeling a bit stiff in the neck there, I might do a quick referral to my physiotherapist. I think he could really help you out with that one. Is that something you want to get checked out? Yeah, okay, well, I'll give you the details anyway, and you'll be able to contact him and get a discount price on the referral, yeah, as part of a care plan that we can sort out for you. Yeah, to help with your stiff neck. Okay. All right. Well, that should pretty much do today's examination. Did you have any other questions or concerns? No? Okay, well then, I guess we'll see you in 1 year's time for your 2021 annual scheduled physical examination. A bit of a tongue twister. All right. Take care. If you enjoyed this one, please hit that like button. And if you really enjoyed, please hit the subscribe button. I'd really appreciate that. Thanks for making it this far, and I hope you enjoy the rest of your day.